Tobacco smoking is a known risk factor of many respiratory infections and increases the severity of respiratory diseases, and as such, smokers are more likely to develop severe disease with COVID-19, which could result in a more detrimental outcome. As Guyana observed World No Tobacco Day on Tuesday, Health Minister Dr. Frank Anthony, during his COVID-19 update, noted that smokers develop a number of underlying conditions and non-communicable diseases, which could increase the chance of developing a more severe form of COVID-19, which may lead to hospitalization or death.
It is something that smokers should bear in mind, that they would be at increased risk based on their underlying illnesses and they're high risk with smoking already.
The subject minister reminded that tobacco is also a major risk factor for non-communicable diseases like cardiovascular disease, cancer, and respiratory disease, which increases the risk of smokers experiencing severe forms of the virus.
One can see the linkages between coronavirus disease and persons who smoke. And if you have underlying conditions, these can obviously it can create more problems for a smoker.
Meanwhile, Minister Anthony underscored that while the tobacco legislation exists to curb the prevalence of tobacco use, advertising and sale in Guyana, shop owners, institutions, and those who manage public places are advised to erect signs and notices that prohibit tobacco smoking. According to Anthony, plans are in place to reduce accessibility of cigarettes, and the Health Ministry has been working closely with institutions and shop owners to sensitize them on the harmful effects of tobacco. The World Health Organization estimates that more than 8 million people globally die every year from tobacco, while more than 7 million of these deaths are from direct tobacco use, and around 1.2 million are due to non-smokers being exposed to secondhand smoke. On the status of vaccination, 66.6% of the adult population are fully vaccinated, while 34.9% of the adolescent population are doubly jabbed. 65,284 adults have received booster doses to date. Reporting for the AGP 90 News, Vogt.